Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager of Hospital Authority. They will give you an account of HA's situation and COVID cases update. We start with Dr. Lau. Good afternoon. Let me first report on HA's situation. We have 1,492 confirmed patients receiving treatment in HA facilities. 197 of them are new cases. As for those requiring isolation, 411 are now in isolation wards, 85 are in second-tier wards, and 448 patients are now in North Lantau Hospital, Hong Kong Infection Control Center, of whom 145 are new infections. Yesterday, we received 6 new reports of patients in critical condition and no new patients in serious condition. For inpatients, there are 28 patients in critical condition and 28 patients in critical condition and 16 in serious condition, and 8 in critical condition are now receiving intensive care. We also received 4 new reports of death cases, comprising 1 male and 3 female patients aged 70 to 94. And among the deceased, 3 of them did not complete the 3-dose vaccine regime. And among the deceased, we had a younger patient, relatively speaking, a 70-year-old elderly lady. She had 3 jabs. On the day in question, she felt unwell and she was sent to the A&E department. And on arrival, well, in fact, regarding her family, right, please give me a moment. In fact, her daughter tested positive. The daughter lives with the deceased, and the patient tested positive by RAT. And on arrival at the A&E department, there was a shortness of breath and some coughs. And shortly after arriving at the A&E department, the pulse of the patient stopped suddenly. Resuscitation was administered. The patient was also intubated. The resuscitation effort was in vain, and the patient passed away at the A&E units. And because of this reason, the case will be referred to the autopsy department or examination. As for the 3 other patients, they haven't completed the 3 jab administration of vaccines, and one of the patients did not have any vaccine jab at all. So I appeal to everyone once again, especially elderly population. If unfortunately you're infected with COVID-19, and if you're not vaccinated, you do have a high risk of having a very severe condition and higher chances of dying. So you should get jabbed as quickly as possible. And if you have received 1 or 2 jabs, you should receive the 3rd jab as quickly as possible to enhance protection. The 3 other patients are respectively 83, 92, and 94 years old. They all had chronic illnesses, including hypertension, cardiac disease, and renal impairment. And that is impairment of the kidneys function. And as of yesterday, 213 patients recovered, including 189 who were discharged. There was also 1 patient testing positive via admission screening or hospital examination, and 1 resident or staff member sharing the same ward is listed as close contact. As for HA staff, 26,401 staff have been infected, and 25,861 of them have returned to the positions. I also have an announcement to make in relation to non-emergency ambulance of Shatin Hospital. 2 staff members of Shatin Hospital tested positive on the 30th of July. And upon contact tracing, the hospital discovered 2 more staffers testing positive. So these 4 staffers at the moment are in stable condition. Whilst on duty, all staff members wore suitable personal protective equipment. So no other staff member has been listed as close contact. The hospital is now investigating the relevant link of these cases, and the hospital has also arranged for staff members as well as patients to get tested, and so far no new case has been identified. The relevant department has been thoroughly cleansed and disinfected, and the non-emergency transport service is not disrupted. Good afternoon. We recorded 4,223 local positive cases, including 1,422 PCR positive cases, as well as 2,801 RAT positive cases successfully confirmed via PCR. We also have 205 imported cases, including 178 PCR positive cases and 27 RAT positive cases. As reported by Dr. Lau, we recorded 4 death cases today. So in the 5th wave, the total death count is 9,318 cases. And among the 205 imported cases, 37 were picked up at the airport, 173 were picked up in quarantine hotels, and 35 were picked up after the subjects have left the quarantine hotels. Most of these cases have high CT values. These may be re-positive cases. And for the 205 cases, they have come from 51 places. For some countries, UK, USA, 18, Philippines, also India, 17 cases. These places have imported more than 10 cases. For the remaining 47 places, they have imported less than 10 cases. We have 3 RCHGs today with cases, and some residents will have to be quarantined. Changfat Onloyuan in Kuaiting, 3 residents and 3 staff members will have to be quarantined because of 1 infection. Bolanggok Dongchong Woloyuan in outlying islands, 1 resident infected with 18 other residents subject to quarantine, including some staff members as well. Chonghua Group of Hospitals, Lo Wong Yokman Elderly Center and Daycare Center, 1 resident infected with 7 residents and 5 staff members to be quarantined. And today is Friday. So schools, we have 255 schools reporting 321 positive cases, including 270 students and 51 teaching staff. They come from 52 kindergartens, childcare centers, 124 primary schools, 74 secondary schools, as well as 5 special schools. 133 schools reported 2 or more than 2 cases in the past 7 days. Today, we have advised the following 2 schools to suspend certain classes for a week. Lok Yu Kindergarten in Central and Western District. Yesterday, in the afternoon, we advised them to suspend some classes because there were 2 pupils and 1 teacher testing positive. This morning, among the classes suspended, we identified 1 more student and 1 more teacher testing positive. For PNGF, there are 21 students with 3 students infected and 2 teachers infected. So PNGF, for this class, it will be suspended for a week. Yunlong Sangwei Primary School, Class 4B, 38 students with 5 infections. Again, this class will be suspended for a week. That concludes my report. Thank you. The floor is now open. Please raise your hand and use the mic when you speak. And before you speak, please introduce the media outlet.
First one. On the left, please, the last row. I'm from Phoenix TV. 3 questions from me. First is about, yesterday, the confirmed cases yesterday rose beyond 5,000. Today's number dropped a bit, but Do you have any control measures underway besides just looking at the continued rise in case numbers? And also, I want to clarify one thing. Right now, locally, what sort of subvariant is actually being spread the most? BA point something? Or any other Omicron still being spread? So what is the main virus being spread in Hong Kong? And how long is its incubation period? And my third question is, everybody's now talking about, well, have heard about shortening the hotel quarantine period. But we've seen a rebound in number of cases recently. And 4 countries are said today that they've got more than 10 imported cases, like UK, up to 40. So if you are to shorten the quarantine period, do you think it's not really a timely move? And the health code plan, would it be postponed? Right now, the pandemic has seen increasing number of infections. Number dropped a bit today, but based on previous experience, sometimes the figures do fluctuate. So we haven't reached the peak yet. The subvariant, where 80% of them being spread, is BA.2.12.2. So actually, BA.2.12.1 made up 75%, and BA.5 and 0.5 made up a similar amount of a percentage of cases. We still have social restrictions and isolation, testing measures, and so forth. As for the quarantine period, if the government has made a decision, they will announce it in due course. I don't have the details on that. Next one. Any other questions? On the left, second last row, lady in black. I'm from Ming Pao. On imported cases, well, there are 205 imported cases today. 133 were discovered at quarantine hotels. Are the figures accurate? And also, Dr. Chua, recently, has there been any increase in the percentage of cases identified at quarantine hotels? If there's a rise, why is that? Is it that the RAT testing conducted at the airport cannot identify cases quickly enough? And as for death cases, the 17-year-old woman, on the day she died, did her daughter test positive on the same day? And also in the Wong Tai Sin Hospital cluster, I want to know a bit more. Yesterday, you didn't mention of the 94-year-old who passed away. When was she admitted? Why did she get into the hospital? And in the hospital ward itself, how many staff were there and patients were there? Did HA carry out any assessment on the source of infection? How was the virus being spread? Would you carry any genome sequencing to identify the links between various infected cases? And also on malaria, in July till lately, 30 people coming from Africa were diagnosed with malaria. How does the CHP assess the risk of that to the community? How are you going to strengthen your prevention against the risk of malaria? Yeah, you've just reminded me. I think in the imported cases at the airport and quarantine hotels, some miscalculations, 52 actually samples were collected at hospital, and 118 were samples collected at quarantine hotels. The remaining 35 were cases discovered after the people concerned had left the hotel. And malaria, we're quite concerned because it is found among the Africans coming into Hong Kong, and it's identified at the hotel. And according to HA, some of the patients actually were diagnosed with a very serious strain of the malaria virus. And there were also cases of death or people who needed to be treated in ICU. I know HA is doing some information gathering, and we would also, together with HA, carry out any medical surveillance when needed. People with symptoms, we would try to send them to hospital ASAP. And for those in contact with the cases without symptoms, we would carry out testing on them to try to identify any malaria cases as soon as possible. Dr. Lau, any supplement? Let me talk about the death case first. The 70-year-old woman, her daughter took RAT. I didn't know whether she used RAT or not, but she tested positive to COVID-19 virus. That's what our record shows, and we didn't know how she tested herself, and we didn't know when she did the test. But the most important point is that for if you tested positive at home, you need to be more careful. If you cannot have a separate toilet, or if your home environment is too congested and there's a chance of spreading the virus to your family members, then you better be isolated so as to avoid spreading the virus to them. And I don't know whether the old woman got infected at home. I don't have the information offhand, but let me remind the public that, for people who are younger and vaccinated with less serious symptoms, as long as they carry the virus, if there are old people at home sharing the same home, like a 70-year-old, and there's a chance that the old woman or old family member could be infected. On the day the woman took the RAT, she tested positive, but maybe she had already been carrying the virus a couple of days earlier. By the time she went to the A&E ward, her condition deteriorated so quickly, and we need to carry an autopsy afterwards. And for the Wong Tai Sin Hospital cluster, today we identified one more staff who's a nurse who is confirmed to be positive. CT value is 30. Right now, one nurse, 4 patients, including the 94-year-old woman who passed away at the Wong Tai Sin Hospital among the cluster. We don't know how the virus got spread or the direction of spreading, because there are several patients involved and there could be visits made at the hospital as well. So we carry out genome sequencing to see the links between cases and whether the patients were infected in the ward or in the community. Well, the 3 remaining patients, they have been living in the ward all along. So they should have been infected within the ward through various channels. So we're still carrying out an investigation. So we will do the genome sequencing. It's not that we would know the answer necessarily after the sequencing, but it will help us understand more about the causes of infection to avoid a repeat of what happened. The old woman herself, looking at our records, she was admitted into Kwong Wah Hospital first. July 17th, she was admitted into Kwong Wah Hospital because she felt sick. She felt tired. And she could not breathe properly. So her she also vomited. Yeah, she vomited. And she was treated before being transferred on July 20th to the Wong Tai Sin Hospital. As I said, the old woman had various chronic diseases, and her condition kept deteriorating.
That is why we arranged for her family members to pay a visit on the 2nd of August on compassionate grounds, and on the 3rd of August, the visitor as well as the patient tested COVID positive. And in the morning of the 4th, the elderly lady unfortunately passed away. On the question of malaria, at the moment, We've received 19 patients in our hospitals for the treatment of malaria. 8 in Princess Margaret Hospital, 2 in Queen Elizabeth Hospital, and 9 others in Kwong Wai Hospital. Apart from these 19 patients, one patient passed away today in the afternoon. The patient was supposed to receive treatment at Queen Elizabeth Hospital for malaria, but at the time of admission, the patient's condition was very poor and medication was prescribed, but the condition continued to deteriorate. The patient had been receiving treatment in the ICU. On the 3rd of August, the patient was admitted to the medical ward, and soon he was transferred to the ICU with breathing support and medication as well. But unfortunately, this patient passed away this afternoon. For the time being, we'll do our level best. We will arrange for patients being contracted with malaria to receive treatment. We have specialists to follow up on their cases. The speaker is not coming through. The speaker is not using a microphone. The reporter is not using a microphone. Let me take this question first. There are fluctuations in terms of the daily caseload, so we will not only look at the single day's figure. As for cases picked up at the quarantine hotels, it's still during the incubation period, so there isn't a vast difference. As for the 70-year-old female patient, we haven't identified any chronic illnesses, only that, for example, there is the degeneration of his knee joint. She tested RET positive yesterday, and she was sent to the A&E unit, and at the time she reported having coughs and shortness of breath, and whilst receiving treatment she suddenly became unconscious and resuscitation was then administered. Well, that's all we know for now, and it came really quite suddenly. We have no idea whether at the moment this case is related to COVID. It's only because she tested RET positive that she attended the A&E unit. At the moment, we cannot identify the cause of this case. Next reporter, I'm from TVB. 4 questions about malaria. Will arrivals from Africa be subject to a blood test before they're allowed to go to quarantine hotels? And at the moment, do we have adequate supply of medication for malaria? Do we need to procure medication from the mainland? And also today, can you tell me the figures in relation to children between 6 months and 3 years old having been jabbed or having made a booking? Let me take the questions first. For the cases that have come to us, quite a large proportion of these cases have arrived from Guinea in Africa, because Africa and Guinea is a malaria endemic region. It is difficult to subject every arrival from the region to the blood test. Meanwhile, we have identified quite a lot of cases from Guinea suffering from malaria. So when they arrive in Hong Kong, we would ask whether they have any symptoms, and if they do have symptoms of malaria, they will be sent to hospital. Otherwise, we would see if they consent to taking a blood sample followed by medical surveillance. We hope to identify these cases as quickly as possible. And of course, for the travel collaterals, we also wish to see if special treatment is warranted. I do not have figures in relation to vaccination for children between 6 months and 3 years old. Dr. Lau. The hospital authority, as a matter of standing practice, does procure medication for different conditions and diseases from around the world. And very recently, we've seen a surge in the number of cases. And according to experts, the patient's condition is really quite severe. And we haven't seen for a while that even on arrival, the level of parasites in the patient's body is of a very high level. And we have started the procurement program, and so far we have adequate supply of medication for these patients. But at the same time, we will continue to have arrivals from overseas and perhaps more such cases. So we'll keep it in view, and if necessary, we will strive to procure more medication from different places to maintain an adequate level to treat our patients. Next question, in the middle. I'm from Cable. On the question of the 70-year-old female patient, how long did she wait at the A&E unit? As for malaria, which hotel did the malaria patients stay during the quarantine period? Is it Silka Hotel in Yamate? And finally, how many hospital beds are made available for malaria patients by the hospital authority? And about borrowing drugs from other places, what quantity are we talking about and from where? For malaria patients, we announced some 30 cases starting July to yesterday. And indeed, some patients had resided in the hotel you mentioned. And meanwhile, there were other cases residing in other hotels, some 6 or 7 other hotels. According to the record, the patient registered at the A&E department and then waited for 45 minutes, 1 hour before finally seeing a doctor. And during consultation, her condition was found to be rapidly deteriorating, and that is why resuscitation was administered immediately. We won't make available in advance hospital beds for malaria patients in particular. But after all, since it's a communicable disease, it's infectious, arrangements will be made. But unlike COVID-19, malaria virus is not an airborne disease. Basically, the vector is mosquitoes. So basically, we need to deal with mosquito infestation. And for hospitals, we adopt the highest level to guard against mosquito infestation. And according to experts, this species of mosquito is not commonly found in Hong Kong. Nevertheless, we do our level best and do all we can, and that is to minimize the chance of mosquito infestation. We also try to stem out mosquito as well. What is the next question, please? As I explained just now, as long as there is supply of medication from anywhere around the world, we would make a procurement effort in order to maintain a stable supply. The mainland is one of our sources because of our close proximity. If we are to get drugs from the mainland, we could do so quite expeditiously within a day. And the level of drugs to be procured depends on how many patients we have received. Experts will calculate or estimate according to how many arrivals we have from Africa and the percentage of malaria patients among them. But when we receive more arrivals from Africa, we will need to stockpile the relevant medication to prevent the surge in the number of malaria cases.
Next one. on the right, second last row. From now, at quarantine hotels, if positive cases are found, normally on what day would you discover those cases? And there's now talk of shortening the quarantine period. Well, for actually more than 10% of the cases were discovered after a person has left the hotel. So if you are to shorten the quarantine period to 5+2 or 4+3, would that pose any additional strain on the medical system? And my second question is, are you concentrating now on schools cases and also those at residential care homes? So therefore, there's no breakdown on the number of cases in restaurants, or is it that there are no clusters in restaurants? If that's the case, then would you consider on August 10th would relax the measures on bars and so forth? Quarantine hotels cases found there or at the airport, I don't offhand accurate breakdowns. We need to wait for the overall analysis to be completed by the HA and to be announced to the public. You know that we've got 4,000 to 5,000 cases a day, so it's difficult for us to actually trace the itineraries of all cases. So all we do is mainly to quarantine the patients or family members. For schools and residential care homes, we're more worried about that because we don't want to see big clusters at those premises. For residential care homes, residents there tend to be old and frail. So if they are infected, there could be the chances of serious complications. So therefore, we are more concerned about them and would trace those cases more regularly. And we haven't discovered any major clusters in restaurants, and therefore we haven't made any announcement on the number in that category. In Hong Kong, we have seen increasing number of cases. So the government doesn't think that it can relax the social restrictions yet. If there are no other questions, that's the end of today's briefing. Thank you. Sorry, the speaker is not using the mic. Well, 19 are those undergoing treatment at hospitals. The 19 patients does not include the one who passed away today, so that means there were 20 before the person passed away.